My name is Caitlin Mulvihill, and this is my presentation on music therapy for individuals with schizophrenia spectrum disorders. In this presentation, I'll cover what schizophrenia spectrum disorders are, some of the need areas to address in both traditional forms of treatment and music therapy treatments. I chose schizophrenia spectrum disorders as my topic because I learned about it recently in my abnormal psychology class and realized there was much more to it than I'd previously realized. And I wanted to use this opportunity to learn more in depth about schizophrenia and to learn about how music therapy can be used to treat it. I have a brief video here called Tell Me About Schizophrenia that I think gives a good overview of the disorder.
Imagine you're sitting in a room surrounded by 100 televisions, all on different channels with the volume turned all the way up. Now try to concentrate on one of the televisions. Try to make out one single sentence. Now imagine having that much noise in your head every minute of every hour of every day. Welcome to reality for 2.4 million American adults living with schizophrenia. Because schizophrenia manifests differently in every person, it might not be hundreds of televisions, but voices in your head that no one else hears, or different symptoms entirely. These distractions can be overwhelming experiences that lead to decisions and behaviors others find troubling. Schizophrenia doesn't appear to be linked to one specific cause. Studies suggest it could be the result of several interconnected factors, like brain chemistry, genetics, and environmental triggers. Thankfully, there are treatments which help manage schizophrenia, and, with the support of others, recovery is possible. You are not alone. We can help.
Next, I'm going to give some background on schizophrenia, including what it is, some quick facts, the possible causes, and the symptoms and diagnosis. Schizophrenia is a psychotic disorder that can affect functioning in every aspect of life and is characterized by unusual perceptions, odd thoughts, disturbed emotions, and motor abnormalities. Something that I learned in my abnormal psychology class that I didn't know previously is that schizophrenia is actually part of a whole spectrum of disorders called schizophrenia spectrum disorders. And these disorders differ mainly by particular durations and sets of symptoms. Other than schizophrenia, the spectrum includes brief psychotic disorder, schizophreniform disorder, schizoaffective disorder, delusional disorder, psychotic disorder due to another medical condition, and substance or medication-induced psychotic disorder. In this presentation, I'm going to focus primarily on schizophrenia because it's the most prevalent of these disorders, but most of the explanations and treatments are applicable to the other disorders as well. Here are some quick facts about schizophrenia. At some point in their lifetime, 1% of the world population will be affected by schizophrenia. Equal numbers of men and women are diagnosed. The average age of onset is in the 20s for both men and women. And most people who experience schizophrenia, about 75%, will have it for the rest of their lives, though 50% are able to improve over time. And though schizophrenia can affect anyone regardless of socioeconomic status, it's most commonly found at lower economic levels. There are two main groups of schizophrenic symptoms. I've included a little clip art of a battery to represent that there are positive and negative symptoms. Positive and negative does not imply good and bad here, but rather positive symptoms are something that is in excess or added to normal behavior, and negative symptoms are deficits or something that's lacking from normal behavior. Positive symptoms can include delusions, disorganized thinking and speech, heightened perceptions and hallucinations, and inappropriate affect. And negative symptoms include poverty of speech, restricted affect, loss of volition, and social withdrawal. Negative symptoms actually appear in 73% of schizophrenia cases before positive symptoms. Also, depressive symptoms are among the earliest and most frequent signs of beginning schizophrenia. In addition to positive and negative symptoms, there also can be psychomotor symptoms. Catatonia can occur in extreme symptoms or extreme cases, and I've included a video here to show what catatonia might look like.
I'm just going to move your arms gently.
So there are a couple of forms of catatonia. The one I'm going to show you here is catatonic posturing, also sometimes called wavy flexibility. can assume awkward or bizarre positions for long periods of time.
You said that.
In addition to this, there's also catatonic stupor, in which a person can stop responding to their environment and remain motionless and silent for long stretches of time. And then there's catatonic excitement, which is when a person sometimes will wildly wave their arms and legs. Diagnosis of schizophrenia can be complicated because lack of self-awareness is common in individuals with schizophrenia. In the DSM-5, the individual must exhibit at least 2 of the symptoms that I've listed here in order to be diagnosed with schizophrenia. There are 4 main possible causes for schizophrenia, one of which is genetics. Genetic researchers believe that some people inherit a biological predisposition to schizophrenia and then develop the disorder later when they face extreme stress, usually during late adolescence or early adulthood. Also, roughly 10% of people with a first-degree relative diagnosis of schizophrenia, so a parent or a sibling, will be diagnosed with schizophrenia themselves. An identical twin has a 50% chance of being diagnosed with schizophrenia if their twin has it. Another possible cause is the environment. Exposure to viruses or malnutrition before birth can increase the risk of schizophrenia. African Americans are almost twice as likely to develop schizophrenia than white Americans. The cause for this is unknown, but it may be related to the higher amount of African Americans in lower economic backgrounds. As I mentioned earlier in the presentation, schizophrenia occurs in all economic classes, but is most frequent in lower classes. Brain chemistry is another possible cause. There is a theory called the dopamine hypothesis, which theorizes that schizophrenia occurs when there is excessive activity of dopamine, a neurotransmitter. The last possible cause is substance use. Some studies have suggested that taking mind-altering drugs during teen years and young adulthood can increase the risk of schizophrenia. The younger and more frequent the use, the greater the risk. Some of the need areas for treatment include depression, which is often caused from isolation as a result of the disorder, and then treatment for the negative and positive symptoms, and for feelings of helplessness and feelings of being alone. Now that we have a better understanding of what schizophrenia spectrum disorders are and what the need areas might be, I'm going to cover some of the traditional treatments and then some of the music therapy treatments. One of the biggest treatments for schizophrenia is drug treatments, particularly antipsychotic drugs. As it says here, the discovery of these drugs revolutionized treatment for schizophrenia. Antipsychotic drugs do not cure schizophrenia, but they are useful to minimize or eliminate symptoms in at least 65% of schizophrenic patients. They work by blocking the excessive activity of dopamine in the brain. Psychotherapy is also a popular treatment for schizophrenia, particularly cognitive behavioral therapy, which aims to teach clients about the biological causes of hallucinations, as well as how to challenge the power of their hallucinations and more accurately interpret them. It also works to teach clients coping skills for dealing with unpleasant hallucinations. This can help people with schizophrenia to feel more control over their symptoms. Community treatment has become more popular as well. In 1963, Congress passed the Community Mental Health Act, which provided that patients with psychological disorders were to receive a range of mental health services in their communities rather than being transported to institutions far from home. Community mental health centers provide resources to individuals with schizophrenia through inpatient, outpatient centers, psychotherapy, supervised residencies like group homes, and occupational training. There are a lot of benefits of music therapy for this population. Music therapy can be very effective in treating the negative symptoms of schizophrenia, such as poverty of speech, restricted affect, loss of volition, and social withdrawal. According to Helen Odell Miller, experience has shown that people with long-term chronic mental health problems, such as schizophrenia and manic depression, have been able to remain outside the hospital ward environment whilst engaged in music therapy and did have fewer episodes of breakdown than before music therapy started. And Gillian Langdon stated that we can see the beneficial aspects of music therapy, such as grounding, enlivening, community building, and community reintegration. Rhythmic experiences especially can be helpful when used as grounding techniques because rhythm is an innate part of human nature found in the way we walk, breathe, and speak. By focusing on rhythm techniques, it's possible to stimulate the individual into action. As the patient becomes more involved in the session, they will slowly come into the present outer world and begin to participate more actively in the therapy sessions, which opens up the opportunity for deeper therapeutic experiences. Group music therapy sessions are vital in providing opportunities for relationship building with fellow patients. It can be challenging for people to communicate using words, especially those with serious mental illnesses like schizophrenia. Through using music as an alternative medium of communication, relationship building becomes easier. A study done by Costa and Negreiros Viana, sorry if I mispronounced that, showed that patients with schizophrenia in inpatient units were more often seen in the company of other people when participating in music therapy sessions than those who did not. Lastly, improvisation can be helpful to the therapist in gaining more understanding of their client. The way clients improvise may reflect their current states and can lead to an understanding of internal and external, interpersonal and interpersonal changes. Adults diagnosed with mental illness often have lost their sense of self, and their relationship to others and to society has become disturbed. Improvisation allows them to symbolically express emotions, thoughts, and memories through music making, and it provides interaction of their own sounds with the sounds of other group members of the group, which is a form of communication and relationship building. This assignment gave me an opportunity to gain a much deeper understanding of schizophrenia, which I believe is an area of mental health that many people, therapists included, still shy away from. It also gave me really important insights into just how beneficial music therapy can be for people with mental illness, particularly schizophrenia.